Good evening, every student present here. The topic for today is Respiratory Medicine CBS session, and the faculty that we have here is Dr. Asif Iqbal sir. He is a HOD Respiratory Critical Care and ECMO Services at Apollo Multi Speciality Hospital, Kolkata. Over to you, sir. Thank you.
Okay, so the student today I will discuss about the respiratory system CBS. So in the CBS, you might get, there is a three table. For first one is your lab. Second one is your image carbon loops, and third one is your image. So in the image section, you will get the X-ray, CT, and also you will get MRI is very rarely give. In the image section, they will give you the USG image, ultrasound image, or X-ray image, and the CT scan mainly. So in the ultrasound image, you might get cases of abdomen, pyelonephritis, pancreatitis, gallstone, or hepatic abscess like that, aneurysm sometime. In X-ray, mainly the chest X-ray, and or else it may be your gas under diaphragm, the bowel perforation, sometime hiatus hernia. And in the CT, you might get both the abdomen, brain, chest, and all. So today I will restrict my CBS lecture on the X-ray. So someone has to be volunteer again today. So who will take volunteer today? Nidhi, you can do. Okay. Uh, Nidhi, are you there? Dr. Nidhi Agarwal, I'm talking to you. Are you ready to volunteer with me? Anyone can unmute and
Hello.
do volunteer.
हाँ जी सर.
Otherwise, yeah.
It may be
Nidhi, yeah,
some
Nidhi,
parahilar
start.
mass. It looks like some parahilar mass, left parahilar mass, or maybe hiatus hernia, as we are not seeing gas under the diaphragm, gas below the diaphragm in the stomach.
Gas on the diaphragm, you are getting.
Gas in the stomach gas we are not seeing below the diaphragm. So this may be
Yeah.
in the chest. Hiatus hernia may be there.
Parahilar is there. So, what is the common cause of the unilateral hilar opacity? Whatever you know, because it is given schema, so you have to utter at least three diagnoses over here. So one is the can be parahilar mass, and other.
This can be a hiatus hernia, or there may be consolidation,
Hmm.
left-sided pneumonia, nodular mass may be there,
Also
left parahilar nodular
can be
enlargement,
collapse also.
can be collapse, yeah,
Okay.
with blunting
So
of
you
left
have to
CPI
utter all
muscles.
these things. collapse, it can be mass, it can be your the margin also not regular. So pulmonary edema can be there. There is a little the left atrial is obtunded, so there might be pleural effusion.
Pleural effusion.
Okay. Now, what is this image showing?
Riles tube in lungs.
Right lower zone
So
dizziness,
you will say that
consolidation,
the chest X-ray
or
showing that
it's
the
you going on
right
the
tube in the right conquer with there
yeah,
is a
rest
aspiration
going on the right
only.
side.
Yeah. Anything else you are seeing here?
The rest going on the right side, right bronchus.
Right side. Yeah. And aspiration
And it
pneumonia
will
is
be,
there.
yes, sir.
And there is a calcification on the knuckle.
Aortic aortic knuckle calcification.
Yeah. So what are the findings here?
Subcutaneous emphysema, post-sternotomy sutures with rib fractures.
It's a pleural chest. It's a multiple side with fracture on the right side with subcutaneous emphysema.
Hmm.
Maybe
Anything
pneumothorax.
else? Maybe
Used to
pneumothorax,
CBG
not me.
sutures. And there is a
Yes. Anything?
Also, sir, lung contusions are possible over right
Very
side.
good. Yeah, lung condition you have to utter. There is a rib fracture, there is a subcutaneous emphysema, lung contusion, the post-thoracotomy suture, and anything else you are
Catheter
seeing?
in the left
Left chest, there is a catheter. Yes. So whatever you will see, you will this things because there is no not get the marks. Now here, what you're seeing?
is right CBP line, endotracheal.
Yeah.
ECG leads
Hmm.
with wires. So
So you have seen the CVP line over here. Okay. Then you have seen the
Riles tube.
this feeding
feeding tube. Maybe.
right to a
There
little
is
lower.
IABP, sir. IABP is there.
IABP.
There is a IBP.
Yeah,
You have to utter. If you miss this IBP, you will not get the marks. Okay. Here is the IBP and the other ECG leads. Okay. So very carefully you will check the chest X-ray.